All right, so my name's Diane, and I got hired on here about 6 weeks ago to be in charge of training and whatever else Allison turns over my way to help alleviate her plate, take a few things off there. But so you'll be hearing from me, letting you know some of the changes that we're doing in our training. And this must be Kathy, our
Yes.
We decided we would just start without you for a minute.
I'm so glad. I'm so glad.
No, that's okay. Anyway, as part of training, it'll still be a little while. Go ahead and have a seat. It's going to be a little bit before we tell you exactly which skills we want everybody to come in. We now have a mannequin. She is in the other room, and we closed the door. We didn't want to freak anybody out to see a body in there. But it's one of those where we can change whether it's a male or a female. So it's either Aspen Annie or Aspen Andy. So whichever one you need to train on. We just had Angela come in yesterday to train on a new client. She was going, and we got it all figured out and helped her do some training, and hopefully that helped you feel a little more confident walking into the situation. So that's one of my jobs, is to help you feel confident walking into a situation. So feel free to come. We can practice on the mannequin, or we can practice on Allison, or anybody else.
That's volunteering.
Yes. So anyway, so when you get something that says Diane, it's just me. So what else was I? That's it. Yeah, I wanted to make sure you got that we knew there's a mannequin. And so now I'll turn the time over to Kathy, who's going to, I can see she's already prepared. She's putting in new batteries. And we've also got some stuff up here. So
Awesome.
We have some extra stuff. But she's going to be talking to us about blood pressure and compression drops and a whole bunch of other things.
The list goes on and on.
Oh, good.
The list goes on and on.
It really doesn't. We're doing really basic stuff today. So
Well, we always need the basics.
yeah.
Yes, we do.
Because sometimes, we don't do some of that stuff enough that we're like, what? I mean, it's a lot better than doing it by hand.
Yeah. Yes, for sure.
All right. Okay. Thank you, Kathy.
You bet.
And we are recording this, so don't be
Okay.
too obnoxious in front of the camera.
Most of them are Great. Okay, I do have a handout, and I do have candy. So hopefully,
You came prepared.
well, with candy.
If you get too much, just throw candy at us.
Yeah, so there's candy right there if anybody wants it. I do have a handout, so let me just, yes.
I can help with that. Oh.
Thank you so much for letting me come, by the way. And my name is Kathy Marston. I'm actually a neighbor of Gary and Julie Staples, late Gary and Julie Staples, and thank you for letting me come. What great people, and what an opportunity and privilege it is to come and meet with you. And you guys have got one of the hardest and most rewarding jobs in the whole world. There's nothing better than being a caregiver. So I'm going to tell you a little bit about my history. I've been a nurse for almost 40 years, and I worked intensive care at Utah Valley Hospital 2 days a week, and then I did home health and hospice on the side, and I loved both of those. And the thing I didn't like about the hospital is I was missing too much of my kids' stuff. So I started doing more home care and hospice, and I just absolutely love it, and I'm still doing it. So it's just a real privilege to go to people's homes and get to know their story. And you guys have that opportunity of getting to know their story. So thank you for doing that. Today we are going to talk about very basic skills. And those are just blood pressure, heart rate, oxygen level, temperature, and respiratory rate. So why do you think we check our vital signs on patients or ourselves? I get everybody involved, so I'll take the candy away. we doing?
Very basically, obviously with blood pressure, possibility of stroke, if it goes too high.
Yes.
And, you know, if the pulse is racing, obviously, you know, you're in a situation where they're in distress of some kind or
That's
other.
right. Yeah. So the vital signs will tell us basic things of what's going on with patients. It doesn't tell us everything, but it certainly does tell us a lot, okay? So I want to go over some basic vital signs today. So the first one, let's talk about a temperature. Do you guys know what a normal temperature is? What they consider textbook normal?
98.6.
98.6. So if people are lower than that, what is that considered?
If it's a lot lower, hypothermia.
Hypothermia, if they're a lot lower. 95 or less is considered hypothermia. So if they're higher than that, what's that considered?
Fever.
Yeah, fever.
They've got a fever. They're running a fever, they've got a temperature. So, and typically what we see with fevers are indications of infection. So, because you guys work with a lot of seniors, what is one of the biggest infections that you guys see?
UTI.
A UTI. And a lot of seniors do not have symptoms of urinary tract infection, so it's important that you understand, okay, they've got a low-grade fever, so 99 is considered a low-grade fever. So if they're 101 or 102, they're running a significant fever. What do we do to bring fevers down? What's the medication that's over the counter that a lot of us use?
Tylenol.
Tylenol. Tylenol is one of the big ones we use to bring fevers down. Now, I know that you guys can't administer that unless family has said, yes, go ahead and give them a Tylenol or whatever else. But if you've got somebody that is more confused than they normally were and is running a fever, that is one of the first things you want to look for, is to see if they are running, if they've got a urinary tract infection, okay? Okay, that is temperature. And what is a pulse rate or a heart rate? What does that tell us? Where does it come from? It comes from the heart, okay? So it tells us how well our heart is beating, okay? So when a normal heart rate is 60 to 100, that's quite a range, isn't it? So what they have said is, okay, we've taken 1,000 people, and of those 1,000 people, our heart rate is anywhere from 60 to 100. That was their average. Now that doesn't take into account for all of those athletes that have got heart rates that are in the 30s, or elderly people that have got an atrial fibrillation that has got a heart rate up into the 120s, okay? So they've averaged all of that out. So a normal heart rate is 60 to 100. How do you check a pulse or heart rate?
You can
Yeah.
do it on the wrist.
On the wrist.
2 fingers.
So I want everybody to put 2 fingers like this, and on your thumb side, you've got an artery. I want you to see, now don't push too hard, I just want you to see if you can feel that. Okay, how many of you have watches on? Okay, you can check this pulse for a whole minute, or you can check it for 15 seconds, and that will tell you how fast it's going every minute. Okay, so when we say a heart rate of 60, that is how many beats the heart is beating in 1 minute. Okay, now there are a lot of things that you can feel by just feeling that pulse. One, you can feel, see if it's thready, it's going whoosh, whoosh, you can feel that. Or if it's absent, sometimes you don't have a pulse at all. Depends on if they're passed away or not. Or if it's bounding. So if it's really strong, you can feel all of those things. Now, the other thing you want to look at when you check a pulse is look at their extremities. What color are they? Are they white? Are they blue? Are they red? Do they have hair on their legs? That tells us if they've got good circulation or not. Do they have swelling? Those types of things. That tells us how well our heart is beating, okay? Okay, the next thing we're going to talk about is respiratory rate. So that is how many breaths that we are taking in a minute. Do you guys know what a normal respiratory rate is?
12 to 20.
Yeah, we actually expand that, it's 8 to 32. So 8 to 32 is considered a normal respiratory rate. Anything less than 8, you're probably not getting enough breaths and not enough oxygen level. So 8 to 32 is normal. So if you have somebody breathing, you know that they're probably breathing too fast, and at some point they won't be able to sustain that. So have you guys ever used an oximeter? Or those little pulse oximeters? I've got some here today and we'll practice on those. So you guys can practice using those and kind of see if they're picking up correctly or not. Okay? And we'll do a comparison to the oxygen saturation versus the blood pressure, and then it'll tell you if your heart rate is the same, then chances are both of those machines are working. Now, these machines are not perfect. They can fail. So don't just depend on the machine. You have to look at what's going on with the person that you're caring for. And if you have been caring for them for a while and they are looking different than they were, then those are things that you should be alarmed and should be contacting either family or loved ones or your supervisor. Okay? Okay. Blood pressure. Tell me what you know about a blood pressure. What's normal? 120 over 80 is considered textbook normal. So if it's higher than that, what is it considered? Hypertension. If it's lower than that, it's considered hypotension. Exactly. So what causes a high blood pressure?
Stress.
Stress.
The arteries narrow and the blood can't get through.
That's right. Pain. Pain can actually cause the blood pressure to go up. Okay? Infection can cause the blood pressure to go up, or it can cause it to go down. So if you have somebody that is running a fever and their heart rate is up and their blood pressure is either up or down, chances are good that infection is probably getting into their blood, and they probably need to be seen in the emergency room. So blood pressure tells us a lot. It tells us if we are bleeding, if you've got somebody that's had hemorrhoids and they've been bleeding a lot, it tells us if they're bleeding a lot. It tells us if they potentially could have a stroke. It tells us a lot of things. So what do we measure when we measure a blood pressure? There are two different components to it. The systolic and the diastolic. Okay, so what's the systolic? That's that top number. And what is that telling us?
That's when the heart pumps.
That's right. That's when those vessels open and the heart pumps. Okay? What is the diastolic?
It's like the relaxation.
The relaxation or the closing of those vessels. Okay? That's all you need to know about blood pressure. You don't have to remember, oh my gosh, what was that? Just remember that a normal heart or blood pressure is 120 over 80, and that if it's lower than that, it could be potentially harmful to them. If they stand up and they're lightheaded and dizzy, chances are good their blood pressure is low. Or if they have a high blood pressure, you've got to look at other things. Did they take their blood pressure medication this morning correctly? Because that will cause their blood pressure, keep saying heart rate, their blood pressure to go up. There are other things, pain, infection, a lot of things will cause blood pressure to go up. Okay? If their heart's not beating well, a lot of things can happen to that. Okay, do you guys have any questions, concerns, comments? Have you had patients that you've taken care of that have had blood pressure?
I have one lady I take care of, and her blood pressure is just all over the place. And sometimes it's even gone up to 180.
Oh, wow.
And it's concerning, and straight away I'm thinking, oh, call a family member, and they insist that I don't. But she drinks cherry juice, and it brings it back down.
Oh,
And she said her heart specialist said she's very unusual.
she is very unusual.
In as much that the cherry juice does do.
Is it sour cherry juice? Or is it
It's a sharp. Tart
okay,
cherry juice.
the tart,
Yes.
yeah. Yeah, interesting.
Anyway, it's always a concern to me because she'll always insist I'll take her blood pressure, chart it, and then she won't accept that first number. She said, oh, I'll do it again, let me do it again, and not even waiting a few minutes. I mean, she's doing it immediately. So she's obviously not getting a true reading, is she?
Probably
She
not.
does it.
Probably not. So when you do a blood pressure and you question the reading, wait at least 1 minute to do it again. So now you may get different blood pressures from one arm to the other arm. That's not uncommon. You also, if you have somebody that's getting lightheaded or dizzy when they stand, it's a good idea to check their blood pressure while they're lying down. Have them sit up, check their blood pressure again, and then have them stand and check the blood pressure. And if that blood pressure goes down, they have what they call orthostatic hypotension, which meaning their blood pressure will drop as they sit and as they stand. And that is something that they need to see the doctor for. So those are things that you guys can do in the home and just record that, to just say, she was getting lightheaded, so I had her lay down, check the blood pressure, had her sit up, and then had them stand and check the blood pressure and record those. And then kind of keep an eye on those, especially if they get lightheaded and dizzy. If they are getting lightheaded or dizzy, what do you want to do before you get them up and walking up?
So it's so noisy.
That's all right.
It's a bit difficult
What do you want to do if you've got somebody that's getting lightheaded or dizzy when you stand them? You want them to stand there for a few minutes before they just take off walking. Take good deep breaths, a few good deep breaths, make sure they're not lightheaded or dizzy before they take off, okay? That's always helpful. Okay, and then the last vital sign that I want to talk about is oxygen saturation. What does oxygen saturation tell you? What does that mean to you? What is that number? Yes.
It's the percentage of oxygen that's running through your blood. How
That's
much
right.
oxygen your cells are getting.
That's right. So our red blood cells have two components to it. It has a hematocrit, which tells us how much iron we have, and a hemoglobin. And our hemoglobin is the guy that carries the oxygen. So if our red blood cells are low, you're not going to get as much oxygen to your cells. And where do we usually check that? On a finger. So what is a normal oxygen level? 90 or above, unless they have COPD. Do you know what COPD is? Chronic obstructive pulmonary disease. People that have had history of asthma or smoking or congestive heart failure or PEs or lung disease typically have COPD. And so with them, depending if it's a chronic condition or not, 88 to about 91 is a good oxygen level for them. We don't want them too high. So we breathe normally because we have the need of oxygen. We have the need to get oxygen into our lungs and into the cells. With COPD, they breathe because they want to blow off the CO2. That's why they breathe. And so if we put too much oxygen into them, they won't blow off as much CO2, and then it could compromise their health. Does that make sense? Okay, so today, this is going to be pretty interactive. And I've got a bunch of stuff I want you guys to check your own temperatures, check your buddies' temperatures. I want you to play with different types of machines. So I'm going to go through a couple of them. We're going to start with the oxygen saturation. It looks like this. You can buy these almost anywhere. This is from Walmart. So you put your finger in there and then you turn it on. Let's see if this one was. We'll see how close they are. And then it will take a minute for it to read. Each one of these will tell you this is going up and down. It tells you how good the signal is. Okay, this one is the same right in the center. Okay, so this is telling me that my oxygen saturation is 93 and my heart rate is 77. okay? And this one says that my oxygen is 97 and my heart rate is 77, so, okay? Oxygen saturation monitors, they're really easy to use. Stick them on a finger, yes.
How do they actually work? How do they, I mean, the pulse is obviously, but how does it register the oxygen in the
Great.
blood?
So they have a red light in here.
Mhm.
That red light reflects off your red blood cell.
Oh, interesting, okay,
Yeah.
okay.
So all of them have got that red light and it reflects off your red blood cell. Now, can you make them work like this? You can, because sometimes if we have nail polish that is too dark, it cannot read through that nail polish. So flipping them over and seeing if they'll work. They don't work as well, but they will work. So
Is it only, does it matter which finger is used?
it
or-
doesn't.
Okay.
You know, that's a great question.
I
I never
Just 'cause she's doing them on all.
Yeah, I never use the thumb.
Okay.
You can, because it still has arteries and veins and blood going through it, but I never use the thumb. I have heard, and no doctor has said, oh yeah, that's true, that your ring finger is the best to use because that goes straight to your heart. Is it accurate? I don't know. I've never heard that. The anatomy I have studied, I'm not seeing that vein and artery go straight to the heart any more than any of the other fingers. But if you can't get it to work, try the ring finger.
Sometimes if fingertips are too cold, you need to heat up the finger to get a good reading.
Yes, put them in warm water. If you've got somebody that has got poor circulation, I've got a little gal now that I'm caring for that was well, she's still smoking. She's a smoker, and she's got very poor circulation, and her hands and her feet are always red and dusky. So I put them in she's got one of those little rice warmers, and I warm that up in the microwave and put her hands in that so that I can warm her hands up too. Check her oxygen level. Now, make sure you're really careful that you don't warm those up too much, because if they've got poor circulation, they probably have numbness and tingling as well, and they will not feel if that's burning their fingers. So be really careful that you don't warm those up too much, okay? Why don't we do our toes? Too far from the heart? It's too far. In the hospital we do. We stick it on their toes, especially if you've got somebody that's pulling stuff up. We'll stick it on their toe and wrap it around their toe. You can pick it up on a toe, but it is better to do your hands because your hands are closer to your heart and you're gonna get a better reading, okay? There's that, okay. I had a couple different thermometers, and unfortunately, I could not locate them this morning. So this is just one of those touch thermometers, and I think we all got used to using these with COVID. So this one you actually touch to the temple, push the button, and then you get a reading. And it didn't work. Let's try that again. So there we go. 98.6. So what other type of thermometers are there? Oral. Okay, where can you use an oral thermometer?
In the mouth.
In the mouth?
Armpits.
Under the armpit?
Rectum.
Rectum. Okay, when would you ever use that?
Baby.
On a baby. Yes, on a baby. Rectally.
Yeah.
Never put it in the mouth. The old thermometers used to have mercury in them. And so mercury is a substance that can get into the lungs, and then the oxygen will adhere to it, and then you can't breathe. So be really careful with those old thermometers. If you have any that still have mercury in them, get rid of them, because you don't want them to be used.
Do they look specifically like a certain way, or how would you tell if it's got mercury versus?
You usually can see it. It's glass, and you usually can see it move up and down.
And that's silver?
And it's silver.
Yeah.
You're
Yep.
gonna have to twist it to see.
Yeah, you'll have to
You
twist
just
it.
Shake it down.
Yes, you have to shake it down.
Do they still have the
These are so
ear,
much better.
the ear ones?
Yes, they still have the ear thermometers, which are great for little kids. You can buy any of those, including this. You can buy at almost any store, Walmart, Walgreens, Safeway, Smith's, they all sell these. Or any medical supply, or Amazon. Amazing what Amazon sells, so. Okay, so thermometer. You can use it on the temporal, you can use it just by scanning, And I'm sure you guys have gone to different facilities where you just scanned it, they want to know your temperature, and they're still doing that in a lot of facilities. They want to know what your temperature is, so in case you do have something that is infectious, they don't want you exposing anybody else, so. And if you do run a fever and you have symptoms of even a cold, don't go in and see your little folks, or at least wear a mask if you're not having any symptoms, okay? Okay, temperature. Okay, I've got a couple different blood pressure cuffs. One goes on the wrist. You put it on, and with these, the ones I have anyway, you want to have them, so see where this says start and stop? You want to have that so when you do this, it's facing you, you can read it, so it's not upside down. Okay, and then you put this at the level of your heart, and then you hit start, and then ask them to not talk or move. Yeah, and if you've got a talker, they'll continue to talk. So you may not get as accurate reading. So I'm going to do this a couple different ways, and I'll show you the difference between what my heart or what my blood pressure is this way, and then putting it lower, because they are very positional.
I don't feel like they use that a lot, like in a doctor's office.
This is not as accurate as a regular,
Right.
and I personally like the ones that I can actually hear with my stethoscope.
Yeah.
So I put my stethoscope over the artery, and then I make sure I feel the artery, and then I put it over there. Okay, so now let's put it down. And that was 127 over 80. See if it makes any difference. So I want you to compare to yourselves where your blood pressure is, and then also use the other cuff that I'll show you how to use.
Is that usually listed in the care plan that you take their vitals, or is that just something people are just doing?
I think it just asks you if your client's supposed to do it, and then you document it.
Typically,
If it does ask, then you don't.
typically if they have like, they're on hospice or if they have a nurse coming, the nurse will ask you.
Oh,
To
okay.
check
Yeah,
it.
to
Vital
check
signs.
vitals and stuff.
Okay.
Cause my lady, she doesn't require it. But
Yeah.
she does have the oxygen though, and
Uh-huh.
she'll check that herself
Okay.
throughout the day.
Okay, so if you have, do you have clients that are on oxygen?
I do.
Okay, that's 126 over 80. So pretty close. So that's how those work. I've got a couple of those I'll let you guys play with. And then we have this one. This one okay, how you tell where it goes over the artery is they usually have a little line that says artery, or they have a little button or something, okay? Put it on right. And it's much easier to do it on somebody else than yourself.
Yes, yes.
Okay, so you just put it there, and then you hit the start button, and then have them hold still, and I usually have them cross that arm over their heart and just hold really still and check the blood pressure that way. Okay, all right, pretty easy. And then the last one I have that I prefer personally is this one. And I have to go buy a new one because the bladder died. So consequently, okay, and then it's got a stethoscope that goes with it. Do you guys know how to use these? Okay, so some people have been trained, some have not. If this is what the family has, then that's something that you probably need to learn how to do. Ideally, you want to have one of the other ones though, because they are much easier to use. So
Facilities, I feel like they have those as backups.
these,
Yeah,
But they use the other ones most of the time.
yeah, these are kind of a backup system, but this is something that I use all the time. I would prefer this using the other ones, and I do comparisons. I compare the wrist, the arm, and then I get mine out and see where my blood pressure is.
Yeah, when I go to get mine, I'll go to the doctor and they have the, you know, the one that they just turn on, it goes.
Yeah.
And first of all, it kills me.
It
and
hurts
then
your arm
It makes me
and
go
your
really high. So I've started asking, you know, cause I deal with high blood pressure. So they'll do the manual one and it's usually not as high and it's, the doctor says it's the most accurate.
It is.
Yeah.
It really is the most, because you're hearing when those vessels are opening and closing. So, okay, I'm going to let you guys play. So I want you
Do you wanna show the compression sock trick first and then
okay,
do
well
it,
there's,
or totally
okay.
up to you?
compression stockings are funny. So, how many of you guys have ever applied compression stockings before? Okay, tell me why.
Edema.
Because of edema.
Okay, what's the edema caused from?
Heart,
CHF.
not
Other sorts of things.
Okay.
not so,
Yeah, it could be congestive heart failure, it could be kidney failure, it could be peripheral vascular disease, that they just cannot get that fluid back up. It also could be lymphedema. Have you ever heard of lymphedema before? So we have a lymphatic system in our body, and if those lymph nodes are not draining fluid as well as they should, then it will pool. And where does it typically pool? In the legs. It goes to the path of least resistance. You know, we are bound, our bodies are bound to certain laws, and gravity is one of those. And so it will pool in your legs. And so consequently, you'll get lots of swelling in your legs. So you need to understand, first of all, why we are applying stockings and what disease they have that we're applying the stockings for, and what to look for after you have the stockings on, okay? So once you get the stockings on, what do you want to check? Wrinkles, make sure you don't have any wrinkles.
Circulation.
Circulation, how do we check circulation?
Feel the toes or look at the color of the skin.
Yeah, so if they're white, what does that tell you?
There's no blood in there.
That's right, it means your artery is clotted, is occluded. So if they are blue, what does that tell you?
Blocking vein.
It's vein. So the circulation back to your heart is not getting back where it needs to be, okay? If they're red, could be also venous, could be artery as well. So, but if you've got white foot that you didn't have before you put a compression stocking on, take your compression stocking off because it's too tight and it's cutting off circulation to the artery. If they become red or dusky, take it off because chances are good it's cutting circulation out to the vein, and then blood flow can't get back up where it needs to be. So who are the people that should be wearing compression stockings? Everybody. You're exactly right. Okay.
You're on your
Why?
feet a lot.
Yes, if you're on your feet a lot. If you're going on a trip. If you're going to be in an airplane for a long time, you need to wear compression stockings. I'm taking care of a guy right now that is 32 years old. He travels a lot, and he had what we call a saddleback PE. What that means is that both lungs, so this is considered the saddle, both lungs were shattered, were spread with pulmonary embolus, which were clots, and he got it from his leg. He did not have symptoms of having a clot in his leg, but it broke off and hit both of his lungs. I said, you're lucky because our clots don't care where they go. It could have gone to his head and he could have had a stroke at that very young age. So make sure you wear your compression stockings.
I only discovered that by going on a long trip. And when I got off, I thought, what's happened to my feet? So from then on, you know, I sometimes do long haul flights.
Yes,
And I need them.
you need them. We all should be wearing compression stockings when we go on flights.
When is the best time to wear compression socks? I've heard recently that it was like during, like at bedtime.
During where?
At bedtime? Like if you just wanna wear them throughout the, like, once a day, whatever, is it better to wear them like all the time, or just at nighttime, or?
You know, that's a really great question. I have always been taught that you put them on in the morning, you take them off at night, and then you wash them with soap and water, hang them over the, something to dry, either your shower curtain or wherever, and then put them on in the morning. So you don't want to wear them 24 hours a day.
Right.
You want to give your legs a break. But usually when you're up and going, that's when you're going to see more problems with your circulation and problems with getting the blood flow back up to your heart. At night, we're laying down,
Right.
and usually the swelling will go away.
That's what I figured, but that's why I was confused. But
Yeah.
so kind of just when you're most active is kind of the best time.
Yes.
to wear them.
So as we're young, we usually don't get swelling. Why is that?
Because our heart's still good.
Heart's good, but what else is good?
Muscles.
Muscles. And that's what helps get that blood flow back up to your heart, is those muscles contracting. So if you've had surgery and you are down, you're not getting the blood flow back up to your heart that you normally would have gotten getting up and doing the activities that you were doing before. That's why you wear compression stockings, because that'll help support those muscles to help increase your flow back to your heart. Okay? Pregnant women should be wearing compression stockings. So, they're including big arteries and vessels, and so they should be wearing compression stockings while you're pregnant. Okay? Let's see if you've got swelling or edema, if you have leg pain. A lot of the people that I worked with when I was working in the hospital would wear compression stockings. And the reason is because it helps with the discomfort in our legs as we were walking on those cement floors. It really would help kind of support those muscles, and it wouldn't hurt it, our legs wouldn't hurt as much when we got home. So, pregnant ladies, those who are standing for a long period of time, and frequent travelers. Those are the people, travelers. Those are the people that should be using compression stockings. Now, I have been taught a lot of different ways to put these on. And the best, does anybody want to be a volunteer?
Like volunteer a foot or?
A foot, a leg.
Oh yeah.
Yeah.
Too late, sorry, I chose.
No, I don't wanna take my feet off, I've been working.
Okay.
No feet off?
My
Your
shoes
feet
are
off?
in.
Okay. This is just a regular nylon. Okay? So these are fairly easy to go on. I'll show you how quickly these can go on. So usually what I do is I do this. Now there are many ways, and I'll show you another way with the other one. If you want to, we're just gonna put your leg up on a chair if that's
Do
okay.
you want my sock off? Do you want my
Yes,
actual
please.
foot?
Yeah, I do. Thank you so much for being a volunteer. You get extra candy.
You to be a foot long.
Okay, so I usually go,
I recently shaved.
thank you. I usually go right to the toe.
You can't see?
Okay, some of our compression stockings have empty or open toes. Those are the ones I prefer because then I can see what's going on with their toes, okay? Okay, so I usually go right to the toe, I put it over the top, and then go to the heel, okay? And then from there, I walk it up the leg. See how easy that one was? Okay, they're not all this easy. They also make a crate that you can put the compression stocking over, and then it goes over the foot, and then you pull the crate off, and then the compression stocking is on. It's harder to put the compression stocking on the crate than it is on the person, most generally. So I don't use those. You can, you definitely can.
Really good exercise is this one if you're gonna do compression.
Yeah.
Put a band around your arms.
Yeah.
I'm not joking. It's really good for.
I'm always, I've always been concerned sometimes when you get really bad skin, where the skin is so thin.
Oh, yeah.
And you're trying to put on a really tight stocking. I'm
You worry
terrified
about
I'm gonna
tear
go
the
to
skin.
tear.
Okay. There's another way of doing it. So you grab the heel, and then you turn it inside out. There. And I am not good at this way, to be quite frankly honest.
It's easier to put it through and then treat it like a puppet.
Yeah. Okay, you grab the heel, then you put it on the foot. Hold on a minute. And then you get the heel to where the heel needs to go.
So it's almost like a little slipper inside.
And then
You just turn it.
you pull it onto here. Your heel is in place, and then you want to make sure that you get all of the wrinkles out. Okay? And you don't want to put these right directly behind the knee if you can avoid it, because that'll cut off, you've got big veins and arteries running in the back of your leg, and that will cut off circulation. So these are too long for her.
How
So
high
what
do
I
they
would-
go?
How long do these go?
No, how high should they go then?
With these, they would
She's
go,
saying to fold it down,
Yeah.
cause those are too.
fold it
big.
down just a little bit, so so it's not right in the crease of the knee. Okay, but keep an eye on your circulation. So, and most of the patients that have these will have those custom to them. Okay? And there are different levels of compression. So some compression goes up to 40 to 50 centimeters of mercury pressure, which is a lot. And they're hard to get on.
Do you wanna start at like low and then go to high, or?
It depends on how much swelling you have. And the doctor really is the one that decides that. Most of the ones that I have seen are 20 to 30.
So if you're traveling, which one would you buy? Like a
20
Yeah.
to 30.
Okay.
Yeah, there are several companies that sell these. There's a little pharmacy in American Fork called Taylor Drug, and they've got a whole wall of these. So when you're measuring for these, you measure from this little knee bone right there, all the way to the ankle bone, and then 7 inches above, and then that tells you what size you will need. So,
7 inches above, I didn't see the
the ankle.
The ankle, okay.
So you go 7 inches above there, and then that's where you measure the calf. And then you measure the length from that knee bone to that ankle bone. Okay? And that tells you the size that you need. Yeah, so, okay,
Can I show you an easier way to do that sock?
please do.
Because I just finished my CNA training, and I think the way they show us how to do it is a little easier.
Okay,
Yeah, I like-
perfect.
I like the ones in the CNA course.
Okay,
So you start with the inside out.
Oh, that's not the way I did it.
okay, well, I'm learning.
To do it.
Well,
There it is.
so you grab onto the heel from here,
Okay,
and you give it a little, little thing, and then you turn it out, and the heel stays in,
okay.
or the foot part.
Well, you
I
don't
was-
start inside out though.
You start right side out.
You better start right,
Right
yeah.
side out.
Yeah.
Otherwise you're putting it
Because
on
otherwise
back.
I'm back, I'm inside out.
I'm so glad I just finished this course. I am so good.
Aren't they great?
So you're saying I need to start this way?
Yes,
Yeah.
grab the heel.
Okay, that's right. Anyway, the bottom line is, you grab the heel, and you keep your hand on the heel. So when you pull it here, then your hand
Is right on the heel?
It's right on the heel. So then you know that's where you go, and then you put it like this.
Right to the heel.
Uh-huh. And then you could just go like this. And bring it up a little at a time that way.
Okay.
And I just think I'm not doing it very smoothly.
Yeah, and then making sure that you're getting all the wrinkles out.
Right.
Yeah, perfect.
Is it better to be lots on the toes, or?
As long as your heel is where it needs to be, you should be okay. And that's what, you want to get the heel where it needs to be.
Yeah.
So you said you had an easier way?
No,
Okay. Okay,
I just, they taught me a different way while in CNA.
how did they teach you? This
I
is,
think ours
this is
was
how
the-
I was taught.
It's probably this way. Let's see.
Okay,
It
you
should
take
be-
them off.
It's like double wide compared to the ones that they made us practice with.
I know, these are awesome.
I know.
Yeah, they're really easy.
They're about this
This
thin.
is, this is the way I was taught,
Yeah,
but I like it.
yeah. This is how I still apply them, because it's the easiest for me. You know, because her legs aren't fat, her legs aren't swollen, her legs aren't compromised, so she's easy. But those that have got fat legs, they're compromised, they've got swelling, they've got lymphedema, that's where the challenge lies, is getting them on.
So I was taught to get it over the toe
It's one of the highest ones.
and then hold these and then get to the heel and then gradually walk it up.
And that's what I was taught. I only just took it like a year ago.
Yep. That's how I was taught. But see, I've got a wrinkle.
So what happens if there is a wrinkle?
You wanna pull it out.
But what does it cause? Like
Great question. Because if you have a wrinkle there, it's going to cause pressure.
Okay.
And so pressure causes what?
Pressure
Skin breakdown. And they already have compromised circulation. They don't have good circulation. If they get a pressure sore, you run the risk of them losing a leg.
So how she's holding her foot now, so that would be a wrinkle, you'd not wanna
Yes.
pull that out, right?
But it's too long, the sock.
Yeah, the sock is too big
Right.
for her.
Okay.
Okay, I'll let you practice. So, practice doing vital signs. I would practice doing a blood pressure with this, and then a blood pressure with this one. And then if you know how to use the stethoscope, use it as well. So, use it on somebody else, or use it on yourselves. It's harder to use on yourself, but I would buddy up, and then do blood pressure on your wrist, your arm, and then use this. And then check your oxygen saturation, see where it is, and then compare your heart rate to what you're getting with your blood pressure. And that will tell you if you're getting an accurate reading or not. Okay, and then practice with the compression stockings. We have lots of them up here. I was going to bring mine, which are really true compression stockings. These are great.
I just bought
But
mine
they're
on
easy.
Amazon, so they're not like the real deal, but
Yeah,
they're like 20 to 30. My
That
doctor
works.
told me to for
Yeah.
like surgery. I had surgery.
Yeah.
So,
yeah, so
yeah.
that really, they work, that's what most of them are, 20 to 30. Now-
on and off.
Sometimes you will get people that have lymphedema wraps, which are much different than these. And
We have a
And,
couple
yeah.
of clients that have this.
do you? Okay, and so those are a little bit more of a challenge. And we have therapists out there that are actually lymphedema certified therapists that can teach you or teach us how to put those on. I don't know how to do those on accurately unless somebody has said, okay, this is where this line needs to go. So they look like ACE wraps, but they've got special lines on them that you have to get at certain spots on the leg to make sure the compression is accurate. And it's amazing. They also have other ones that kind of look like a foam that kind of overlaps like this, that you can put on the legs. And those are easier to use than the wraps that you have to get that certain line at a certain spot on the leg. But lymphedema specialists, who I've got a lot of them that I work with, can go and teach the patient how to do that and actually go and help them. And then massage. Massage will help get rid of that swelling in the lower legs. But you've got to be careful with massage too. You don't want to impede circulation by massaging too deep. Okay, what questions do you guys have? Practice, yes. Buddy up with the buddy and practice. Okay.
It's like, we've got 10 of you, so if you
Great, yes.
Small cut.
Yes. Oh, yeah.
The arms, I always get
So
Yeah.
I think we should have
Yeah, I do too.
Oh, you are?
there's